Edex injection is used to treat male sexual function problems, erectile dysfunction. It works by helping the blood flow into the penis to prevent maintain an erection. This medication is not recommended for use in men with penile implants. Indications. Edex is indicated for the treatment of erectile dysfunction due to a neurogenic, vasculogenic, psychogenic, or mixed etiology. How to use. Read the patient inflammation leaflet and instructions for use if available from a pharmacist before you start using this medication and each time you get a refill. Learn all preparation and usage instructions. If you have any questions, ask a doctor or pharmacist. This medication is given by injection into the penis as directed by a doctor. Before injecting each dose, clean the injection site with rubbing alcohol. It is important to change the location of the injection site with each dose to avoid problem areas under the skin. Choose an injection site on the other side of the penis from the site of the last dose, using a different area each time. After injection, apply pressure to the injection site with an alcohol swab for about 5 minutes to avoid bruising. Do not use a bent needle to inject this medication. If the needle breaks during injection, contact a doctor right away. Dosage is based on a medical condition and response to therapy. This medication should usually work within 5 to 20 minutes to produce an erection that lasts for about 1 hour. The manufacturer recommends that this medication be used no more than 3 times a week, with at least 1 day between each dose. Before using, check this product visually for particles or discoloration. If either is present, don't use the liquid. The dosage range of Edex for the treatment of erectile dysfunction is 1 to 40 micrograms. The intravenous injection should be given over a 5 to 10 second interval. In a study with a dose range of 1 to 20 micrograms of Edex, the mean dose was 10.7 micrograms at the end of the dose titration period. In 2 studies with a dose range of 1 to 40 micrograms of Edex, the mean dose was 21.9 micrograms at the end of the dose titration period. Doses greater than 40 micrograms has not been studied. A 1/2 inch 27 to 30 gauge needle is generally recommended for the intravenous injection. The patient is advised not to exceed the optimum Edex dose, which was determined in the doctor's office. The lowest possible effective dose should always be used. Edex is given as an intravenous injection over a 5 to 10 second intervals. Contraindications. Edex should not be used in men who have conditions that predispose them to priapism, such as sickle cell anemia, or sickle cell trait, multiple myeloma, or leukemia. For the treatment of erectile dysfunction in men with fibrotic conditions of the penis, such as squamous fibrosis or Peyronie's disease. In men with penile implants. Precautions. Before using alprostadil, tell a doctor or pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before using this medication, tell a doctor or pharmacist your medical history, especially of penis conditions such as angulation, fibrosis, scarring, Peyronie's disease, blood system cancers such as leukemia, multiple myeloma, sickle cell anemia. Use of this drug does not protect against sexually transmitted diseases such as HIV, hepatitis B, gonorrhea, syphilis. To decrease your risk of infection, always use an effective barrier method such as a latex or a polyurethane condom during all sexual activity. Consult a doctor or pharmacist for more details. Side effects. Mild, moderate pain, irritation, or slight bleeding at the injection site may occur. If any of these effects last or get worse, tell doctor or pharmacist promptly. Tell a doctor right away if you have any serious side effects, including redness, tenderness, swelling of the penis, lumps, unusual cavern of the penis. Rarely males may have a painful or prolonged erection lasting 4 or more hours. If this occurs, stop using this drug and get medical help right away, or permanent problems could occur. A very serious allergic reaction to this drug is rare, however, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing.